I'm a board certified infectious disease, wound care, and obesity medicine doctor. I'm in Augusta, Georgia. As a part of the Act on Non-Communicable Disease Week, this is my second video on this topic because I see that metabolic syndrome is influencing a lot on outcomes of infectious disease that I primarily deal with. And WHO has announced Act on Non-Communicable Diseases, and hence I've decided I should contribute to this problem improvement. And my hashtag that I use mostly is removing barriers to healing. And the website is www.iandiabetes.com. And my Twitter handle is @woundphysician. My conflicts of interest are nothing but removing barriers to infection, wound healing, and obesity using people, process, and technology. Now, I want to discuss the topic of metabolic syndrome. It's nothing but a cluster of 5 conditions, and all these are caused by high insulin level. At this high insulin level, the fat is not going to be able to be mobilized to be burnt, and that increases the risk of heart disease, stroke by almost 3 to 5 times. Now, what are the 3 out of the 5 criteria or what make that metabolic syndrome diagnosis? But each of these criteria is single-handedly affected by insulin resistance. We're going to talk a little bit about that too. Now, the first of the criteria is waist circumference for men more than 40 inches, for women more than 35 inches, HDL cholesterol less than 40 milligrams per deciliter in men, less than 50 milligrams per deciliter in women, and for triglycerides, it is when it is greater than 150 milligrams per deciliter, and blood pressure that is greater than 130/85, and fasting glucose more than 100. And when we are able to reverse this metabolic syndrome, which can be easily done by reducing processed grains and sugars and processed food material with ultra processing of food material that could be avoided, and that's when we can add to the improvement of this overall problems. And that's what we're trying to do at AIYAN Diabetes Center. Now, why does all this happen is because of insulin resistance. Now, all these conditions, heart disease, cancer, fatty liver, PCOS, polycystic ovarian syndrome, migraines, arthritis, stroke, dementia, increased body fat, and diabetes, and all these happen because of insulin resistance and affects most of the organs in the body, including GI, endocrine system, skeletal muscles, a lot of inflammation, and psychiatric issues too. All the 3 out of the 4 deaths that happen are contributed because of by the diabetes, heart disease, cancer, and stroke problems. And they have their origins in metabolic syndrome that contribute to diabetes, heart disease, joint problems, cholesterol issues, hypertension, high triglyceride, PCOS, like I talked earlier, and also GERD, liver problems, with fatty liver being one of the silent tsunami that is affecting our healthcare at this point, and also inflammatory diseases of the joints. Now, if you see, this is a simple slide I borrowed from Dr. Robert Lustig. It is affecting around 200. So if the population of US is 240 million, and people say, oh, there is a lot of people who are obese, that is a problem. In reality, insulin resistance and metabolic dysfunction is what we have to target, not just the weight. When somebody tries to get rid of the weight, that's great because they are trying to address the fat mass. But it is a metabolic mayhem that they don't realize. That is more than weight. Even in normal people who have 168 million of them who are normal weight, they have metabolic dysfunction of 40% of that normal weight people. So 67 million of normal weight people and 57 million of obese people, that is 124 million, are really sick. In reality, There was a study done that showed that 88% of Americans have metabolic syndrome. So there's almost 90% of our population has metabolic syndrome. And without addressing metabolic dysfunction and metabolic syndrome, we can address the chronic disease problem that we are facing in this country and across the world. What are the causes of metabolic syndrome? Is nothing but what is insulin resistance? It is a subnormal glucose response to either endogenous or exogenous insulin. Now, insulin is needed to push the glucose into the cell. The more the insulin in the blood, the more the glucose in the blood, the more the problem. So insulin, our body secretes to protect ourselves, but then the more the insulin is a growth hormone, and then that drives the obesity, that drives the problems that are associated with insulin. Now, high insulin can happen because of stress and also counter-regulatory hormones that can be produced. And these hormones sometimes can be there in the morning when you see high increased glucose in the morning. That happens because of cortisol and all the counter-regulatory hormones that are there. And medications can increase it, and oral contraceptives can increase it. HIV medications can increase it. And pregnancy by itself is an insulin resistance condition. And lipomas or lipid dystrophies that happens is a source of insulin resistance, underlying etiology. Now, insulin antibodies can happen, and particularly at that time, they can have type 1 diabetes or type 2 different diabetes that is now being detected as having more than 9 types of type 2 diabetes. There is genetic defects in insulin pathway, that is type 1 insulin resistance, and antibodies that are noted causing type 2 insulin resistance. Now, hyperinsulinemia syndrome, on the top, it's like an iceberg effect. You're only seeing type 2 diabetes and obesity, and the underlying part is where there is atherogenic dyslipidemia, underlying problems with coronary artery disease, polycystic ovarian disease, infertility, erectile dysfunction, Alzheimer's, cancer, gout, fatty liver, and autoimmune conditions, multiple sclerosis, and microbiome problems, and insulin resistance, hypertension, and hyperlipidemia. So we are not seeing these, or they are there, but as an iceberg effect, only on the top we are seeing diabetes and obesity. We need to understand that we are dealing with the branches of the problem, but we are not dealing with the trunk and the root of the problem. The trunk is hyperinsulinemia. So we need to address the hyperinsulinemia, and we need to stop feeding all the carb-loaded foods, the highly processed foods that we are putting at the root of this problem. And unless we address this infection, as you can see with COVID, infectious disease can be exacerbated. You can see yesterday's video that I posted on regarding this. And we at AIYAN Diabetes Center are trying to address this, as metabolic health matter a lot. And we need to understand that all medicine is personal, and every patient is a puzzle, and we have to move away from mass medicine mindset to N of one medicine. And please feel free to contact us if you have any problems with your diabetes, infectious disease, wound care, vascular problems, and metabolic syndrome issues. We can use people, process, and technology. As long as you want to help yourself, we will stretch ourselves to help you. Please feel free to contact us at 706-868-0319. Our website is www.iyandiabetes.com. Thank you very much and have a great day.